This is In the Loop. I'm Christian Bryant. We'll get to those stories in a few, but first, you ever go to pick up a prescription and think, dang, that's a lot of money for something I need? Yeah, you aren't alone. Tonight, we're looking at high drug prices in the US and how new legislation in the Inflation Reduction Act aims to try and cut down on some costs. Let's get into it, folks. The problem is definitely widespread. 6 out of 10 Americans say they use a prescription drug. 8 out of 10 Americans say drugs are unreasonably priced.
The US is one of the only countries in the world where drug companies can set whatever prices they like.
That's Andrew Mulcahy, a senior policy researcher at the RAND Corporation, whose research focuses on prescription drugs and healthcare policy evaluation. Mulcahy spoke to Scripps News about the scope of the problem compared to other similar wealthy nations.
Even after controlling for negotiated discounts between manufacturers and health plans and the PBMs, US prices were still about twice as high as those in other OECD countries.
So why is this the case?
The problem boils down to several different important pieces. One of them is that drug companies are able to pile protections on to the drugs that they have, keeping competition out and keeping prices high.
Robin Feldman, a legal expert on pharmaceutical and intellectual property, spoke to us about those protections, things like drug patents that are put in place to protect intellectual property and encourage scientific innovation.
Unfortunately, drug companies have become adept at piling new patents over and over again onto the same drug. It keeps competitors out and it keeps drug prices high.
When drugs first come out, their primary patents last on average a little less than 10 years. But many pharmaceutical companies are able to re-up their patent protections with slightly different formulations once the original patents expire or are close to expiring. These can then be released with marketing and new patents around being extra strength or slow release versions of the original, tactics known as product hopping or evergreening. But we're still just scratching the surface here. Remember, Feldman said there are several important pieces to all this.
The second problem is that middle players, often called pharmacy benefit managers, are able to siphon off a lot of the costs from the system. They're also able to set secret deals that push health insurance companies to keep drugs on their formularies, on their reimbursement lists, even if those drugs are more expensive, and to favor them over less expensive drugs. Those types of perverse incentives push people towards paying more than they need.
That's how Big Pharma and middle players like insurance companies keep up skyrocketing prices. So what's being done about them? The Inflation Reduction Act of 2022, signed into law by President Biden in August of last year, includes several provisions to lower prescription drug costs for Americans, especially those with Medicare.
The idea is that perhaps these negotiations that happen in the context of Medicare will begin to influence the private drug markets to follow suit.
Over the next several years, the law hopes to reduce drug spending by the federal government through a few different ways. First, by requiring drug makers to pay rebates if certain drug prices rise quicker than inflation. That's a provision that kicks in this year. 2024 and eliminates the 5% cost sharing that Americans on Medicare pay in the so-called catastrophic phase of coverage. That's expected to be a huge relief for folks on expensive brand name drugs that reach this catastrophic level of coverage quickly and are stuck with thousands of dollars in bills through the rest of the year. By 2025, it hopes to add $2,000 to the out-of-pocket cap for seniors on Medicare, and the government plans to continue negotiating prices for drugs in the years after. The legislation took shape during strong public support for the government to address rising drug costs, but has been receiving pushback from the pharmaceutical industry and still has loopholes that are concerning many experts too. For example, it doesn't cover drugs that have generic versions. Generics are typically way cheaper than brand name formulas of any drug, unless the brand manipulates those prices itself to control profits by taking out its own authorized generic.
They don't increase the total number of generics across time, and they triple the magnitude of the brand price increases that happen over time. Each of the effects means that the market for generics is less effective.
The pharmaceutical industry's stronghold over the market means American families are paying the price quite literally. Most prescription drug prices increase in either January or July every year. Usually, the greater chunk of those happen in January. According to data from the Department of Health and Human Services, the number of increases in both months during 2022 was higher than in previous years. In January of last year, the average list price increase was nearly $150 per drug, and in July of 2022, it was $250. The prices of more than 1,200 drugs rose and outpaced inflation, with several drugs upping list prices by more than $20,000 or by more than 500%. Drug makers already increased prices on more than 300 drugs this January. The Inflation Reduction Act, or IRA, aims to curb costs on just 10 of those drugs. These are likely going to be older but vital drugs that have had significant time as patented products on the drug market, not newer drugs.
So I think the IRA provisions have the potential to really help out in a subset of drugs where right now the US is paying very high prices across the board without any kind of negotiated discounts. That applies to oncology drugs, some other kinds of very expensive specialty drugs.
The exact decisions on drugs included for the Medicare Drug Price Negotiation Program isn't due until September 1st of this year. And while we don't know exactly how the rollout of these provisions will play out, experts say we can expect legal challenges to these reforms from Big Pharma.
They fight intensely in the legislatures that are looking at passing them. Then when the particular provisions pass, they are often challenged in court. I wouldn't be surprised to see the pharmaceutical industry challenge various aspects of the Inflation Reduction Act in court in these years before everything goes fully into effect.
The cost of drugs can keep many people from getting the medicine they need, but others have no choice but to pay it because that exact medicine is what's keeping them alive. That's often the case with cancer patients. To give us a look at the real-world impacts of high drug prices, national correspondent Meg Hilling spoke with an oncologist and parents of kids with cancer about how costs of treatment hamper care.
It's the news no one ever wants to receive.
Pediatric cancer diagnosis really impacts the entire family, of course, the patient, but also siblings, parents.
And it's increasingly coming with a price tag very few can afford to pay.
A lot of families, they want to do everything they can, of course, to help their child. And sometimes that means quitting a job so they can take their child to treatment, so they could be there with the child in the hospital, and not all families can do that.
Kate Tillotson is the CEO of Bare Necessities, a nonprofit pediatric cancer foundation that works to support families while searching for cures.
With all of the costs that are involved, we try to offset that by providing, support for transportation costs, utility bills, things like that.
According to a 2021 survey, 61% of cancer patients and survivors find it somewhat or very difficult to afford their care. And over 80% of patients said they've had to make financial sacrifices to cover their healthcare expenses. To put those percentages into perspective, consider the fact that the American Cancer Society estimates that more than 1.9 million new cases of cancer will be diagnosed in the U.S. in 2023. So what exactly is causing this financial hardship for cancer patients? Well, like just about every other medical ailment these days, skyrocketing drug prices. Dr. Hagop Kantarjian is an oncology specialist at the University of Texas MD Anderson Cancer Center. And for the better part of a decade, he's been calling out what he says are exorbitant drug prices.
After we did all these editorials and pleas, over the years, nothing has happened.
Today, the average annual cost of a new cancer drug in the U.S. can reportedly run around $283,000.
So in 2013, the average cancer drug price was anywhere from $100,000 to $120,000 a year. Before 2000, it was probably around $10,000 a year. Today, the average cancer drug price is over $200,000. In 2022, it was $222,000 per year.
This has forced an increasing number of patients to make some gut-wrenching decisions, everything from rationing out medication to even skipping treatment altogether.
Patients with cancer are having, because of the high drug prices, sometimes to make a choice between life and death based on the cost efficacy.
And the U.S. is predominantly alone in having this problem. According to a 2019 study, median cancer drug prices in Europe were 52% lower than U.S. prices. And Dr. Kantarjian says in some cases, the drugs can cost as much as 300% more.
Financial toxicity is very real. There are many people facing cancer or being treated for cancer who have to mortgage their homes, lose their homes, go into bankruptcy, and that's a tragedy. And we need leadership, particularly from government, to change that.
Andrew Shore is a medical journalist and living with 2 types of cancer.
To just give you an idea, I take 4 pills a night for a condition I have called myelofibrosis, and I think the retail cost of those pills is $16,000 a month. I also get an infusion to improve my immune system for the leukemia I have, and that's about another $8,000. And then to boost my energy, there's another shot I get every 3 weeks, and I think that's about $8,000 or $10,000 every 3 weeks.
While a good deal of his regimen is covered by Medicare, he knows many people still struggle with copays.
You need caps on the yearly out-of-pocket cost, and you need to reduce the cost.
As a journalist turned advocate, Shore has spent more than 30 years helping other cancer patients try to make sense of their diagnosis.
I was one of the first, with a few others, as patients to go to medical conventions and cover it as a patient journalist, if you will, not for doctors so they could be informed if they didn't get to go to the medical convention, but for patients who are living with the conditions that were discussed.
And that starts with reading up and asking questions.
When you're told you have a cancer diagnosis, I think it's really imperative that you, your loved ones, your support team, if you will, care partners, get smart. It's very important to include in your options, is there a clinical trial? They may be developing tomorrow's medicine today that I can get, and where the drug in the clinical trial will be provided for free. Not all of the treatment, but maybe the key drug.
Meg Hilling, Scripps News, Chicago.